everyone. My name is Jessica Otero, and today I will be speaking on leveraging social media for COVID equity in the Latino community. I am a clinical research coordinator at Mayo Clinic, our Center for Health Equity and Community Engagement Research, although I also have been working with the NIH Community Engagement Alliance Against COVID-19 Disparities, and I'm excited to share with you all that we've learned in the last couple years throughout the pandemic. So our learning objectives for today will be to discuss the impacts of COVID-19 on the Latino community, assess how to choose what social platform will be most impactful for your priority population, and share practical applications in how to leverage social media for COVID-19. So I'm sure that throughout the symposium this has been discussed or even in people's work. However, I did want to give a brief overview at Latinos and COVID-19. And so, as a lot of people know, COVID-19 is unfortunately disproportionately affecting the Latino community. So for example, California is 39.3% Latino, but they make up 51.4% of COVID-19 cases, and this was on December 29th of 2021. About half of Latinos say that they have faced financial or economic hardship due to COVID, and about half of Latinos say a friend or family member was hospitalized or died because of COVID. And so in order to go into how to use social media or leverage anything really to combat this, we need to discuss why this is the case. So the biggest reason that anyone in public health will tell you is because of various social determinants of health. And these social determinants of health do work together to sustain these disparities. So for example, many in the Latino community, and this isn't for everyone, obviously, but big reasons are lack of medical access. A lot of people, for various reasons, either they don't trust the medical system here in the United States, or they do not have access to care, or maybe they do not have insurance. For example, say you're a migrant farm worker and you're sick, your option is to work and make money or go to the doctor. All those things can work together to affect medical access. There's lack of information that's relevant to each culture. So as a lot of people know, the Latino community, and something we'll discuss a lot, is the Latino community is not monolithic, meaning that the Latino community is composed of various cultures and traditions, and a lot of information is needed to specific cultures if you want to fully reach and make that population feel known. Socioeconomic status, unfortunately, a lot of people of color in the United States, as people well know, are more likely to have lower socioeconomic status. Education plays a role. Overpopulated cities, and I didn't put this in here, but intergenerational homes has been a big reason for Latino disparities. As many people know, Latinos are more likely to be living with parents, grandparents, have a lot of people in the home, making it harder to quarantine, therefore make it easier to spread COVID-19 and increase transmission. Also, zip code. We know that in the United States, redlining, for example, when cities were being developed, is an issue to where people in certain zip codes have less access to care or resources that could affect their ability to get COVID-19 and kind of increase this transmission. And then also comorbidities. We know that unfortunately Latinos are more at risk for certain things. For example, they're disproportionately affected by, let's say, prostate and pancreatic cancer. So already we're being affected by things that unfortunately can lead to worse outcomes with COVID, which is why it could be explained that we see higher death rates in the Latino community. And like I said, all these things play together. So say lack of medical access, somebody doesn't have access to the doctor, but they also don't have information. So if we get a message on WhatsApp, it's really easy to say, oh, it's this is the truth, even if it's not completely relevant or evidence-based. So what maintains these disparities? Mistrust and misinformation throughout the pandemic definitely have maintained these disparities. As a lot of people know, there's a lot of mistrust towards public health governing bodies. For example, ICE raids with the last administration, or a lot of physicians who aren't culturally competent and maybe disregard a person's culture, or even what we would say are our needs in those moments. And misinformation, WhatsApp, Facebook, even Instagram. So many things can be shared that aren't completely accurate. However, people take it as accurate and apply it to their lives, which can end up hurting us. And again, increasing that transmission of COVID-19. And then difficulty accessing evidence-based information or even knowing what evidence-based information is. So I'm going to use the example of my grandma a lot throughout this presentation. So my grandma, she gets messages on WhatsApp all the time. And if she doesn't have her doctor, can't go to her doctor, she'll see a message saying, La vacuna will XYZ to you. And if she doesn't have anyone to go and write that information by them, then she might believe it and she might go through by it and not get vaccinated and ultimately hurt her and those around her for taking that as true. And then also lack of vaccine uptake, although I do want to say that thankfully the numbers have risen in the Latino community, but we still have a lot of work to do. And so, like I said, the purpose of this presentation will be to discuss how we can create these changes or advocate for these changes and animar people to create these changes through social media. So, now what? One thing that I do want to preface is that social media should rarely be the sole way of trying to bring change and should always be done in partnership with the community. If I had a little bit more time, I would go through the human-centered design thinking approach for social media. But a brief overview is that the human-centered design thinking approach believes that the community lies at the center of solutions for anything, even the problems that we think are hard to bring awareness to, or the things that we think are hard to bring change to. Human-centered design thinking puts the power in the community rather than the public health professional to bring that change. So that is one thing I want to preface. We always want to be for the community, with the community, and never just we're doing our job, social media, we're done. So one example that I'll talk about a lot is what we have done with the NIH SEAL Alliance that I mentioned earlier. So right here, this is a panel that we actually had a little while back. And we had collected survey information from the community. So we had understood what the needs were in the community. We knew that a lot of people were concerned about their mental health during the pandemic. As a lot of people know, Latinos, we love community. We love to be together in community. We love to celebrate, dance, all these things. So a lot of people were affected by it, not being able to do that and having to quarantine or social distance from others. And then we also heard that a lot of people had religious reasons for not wanting to get vaccinated. And so we wanted to include someone from the faith-based community. And so, like I said, putting the solution in the community, they told us what they wanted. And so then we provided that and we're able to do this event, which was on Zoom and Facebook. And I'll explain in a second why we chose those platforms. So there are concerns with different social medias, and a lot of older Latinos do report that one of them is difficulty accessing social media. So a lot of people may not be very tech savvy, may not be very familiar with using these different platforms. And there are different preferences based on different demographics. Once again, the Latino community is not monolithic. And so even within age groups or people groups, there's these different preferences. So overall, older Latinos reported not liking Instagram and having trouble. And this was for our community. I do want to say that as well. This isn't representative of the US as a whole. But for our community that we were trying to work with, older Latinos reported not liking Instagram as much and having trouble with Zoom, while younger Latinos reported liking Instagram and Zoom, but not Facebook. And then some reported not feeling comfortable with either. So then it was up to us to figure out, well, we can't go to the community because we want to protect our community, but we also can't, but we're also having this difficulty with what people want. So we had to brainstorm what we could do. And so some practical ways to effectively use these socials, despite those preferences, which we came up with, is one, connecting with community influencers. So every community will have those people that are leaders and that are already making change and making impact. Whatever community you're in, there's always going to be people that others are looking up to. And so that's what we did. We actually, a local county commissioner, she has a community center where vaccinations were being done once a week. And she had, people trusted her and people in the Latino community listened to her. And so we connected with her and we asked her, hey, what's worked for you? And she told us, anything that you do on Zoom, you have to put on Facebook, because some people will use Zoom, but some people don't like it. So always put it on Facebook. And that's what we did. And actually, Facebook keeps the presentation. So Zoom, obviously, once you end it, unless it's recorded and posted somewhere else, it's gone. But on Facebook, it stays there. It stays posted if you transmit that live and then hit post. And so we actually found that it had a large reach and impact because we used both of those platforms. And we wouldn't have known that unless we would have connected with the community influencer and unless she had also. And then another important thing is to collaborate with others who are doing similar efforts. So something that I'll talk about a little bit later as well is you never want to recreate the wheel. During the COVID-19 pandemic, I think a lot of people tried to do the same thing, which is why I'm so grateful for symposiums like this and groups like the Latino Coalition Against COVID-19, which I'm also fortunate to be a part of. But the goal should always be to work together rather than being the best at something, working with others who are just as good to see how you can bring change in the community. It's never about us, always about the community. But you also want to ask questions like, what does the community want? If I'm trying to reach, for example, older community members who are anxious about the vaccine, what do they want? Are they going to use Facebook? Are they going to use Zoom? If I want to reach teenagers or children, even now that the vaccine has been approved for them, am I going to use TikTok? Am I going to use Instagram? And the answer might be different in different communities. So you want to always ask them and also ask what social platforms do people use. And again, thinking back to the human-centered approach of design thinking is getting the answer in the community. So even using a storyboard, having Fulanito is accessing Instagram and sees this, and then this, and then this, and then asking which of these makes most sense to you, or which of these would you most pay attention to, and then going based off that, or having interviews, conversations, just having these discussions in the community, and again, putting power in the community. And so to effectively use socials, despite different preferences, a few other kind of practical suggestions would be crowdsourcing. Crowdsourcing has personally become my favorite public health strategy during the pandemic because it builds community and helps disseminate messaging, but it also creates a relationship, which is one of the most important things in public health. Like I would argue to say that without relationship in public health, it's meaningless because there's no sustainability in it. But so crowdsourcing, North Carolina, their SEAL team, they had a great crowdsourcing contest where they asked people to submit a work of art on what they thought about the vaccine. And so some people wrote songs, some people wrote stories, some people wrote poems, and then they submitted them. So that was cool because it engaged the community. And then the North Carolina SEAL team put that on their social media page. So then they had the content for their social pages. But then on top of that, community members were asked to vote for their favorite ones. And so people who maybe weren't vaccinated or weren't familiar with the COVID-19 vaccine saw that in order to support their the other community members. So just all around, it creates this great engagement with the community, but also a relationship. And personally, within the Latino community, this sounds very exciting to me just because I love to highlight our culture and highlight all the things we can bring to the table that can be beautifully shown through art. And then other things that can be done on social media, encouraging community participation. Another great example of this would be Dear Pandemic, and there's one in Spanish as well called Querida Pandemia. It's housed at Columbia University, and people, kind of like a Dear Abby, are able to send in questions. And they're answered by a team of researchers at Columbia. And so it's really great because, for example, back to my grandma, mi abuelita, if she gets something on WhatsApp and she texts one of her friends who don't know either, her friend could tell her wrong information versus having a tool like Querida Pandemia, Dear Pandemic, my grandma can send in a question there and they will post that. So one, people with similar questions will see that, but also her question will be responded to in an evidence-based manner. And like I said earlier as well, pairing socials together. So for example, if you have a live stream Zoom event, also stream it through Facebook, which is very easy. And I didn't know how to do any of these things before the pandemic, but it was easy to figure out, thankfully. And I do have my email up. And so if anyone has any questions or wants any suggestions, I'm more than happy to share. And then any event that is done, I would definitely recommend that they be posted to your other social channels. So even if that's not the primary channel you use, say you do a Facebook or Zoom event, also post it to Instagram or whatever social you have, just because it increases your ability to increase your reach. And so thinking about effectively using socials, You want to identify SMART goals. So SMART goals are specific, measurable, achievable, relevant, and time-bound. For example, for a COVID-19 related one, I might say, in the next 2 months, I'm going to plan one Zoom event with 6 panelists that has at least 50 participants. So I was specific, it was measurable because of the amount I put in there, relevant to COVID-19, and time-bound to those 2 months. You want to identify your audience and create your relationship. Again, remembering that the Latino community is not monolithic. So, for example, in Central Florida, I might be serving, there's a big Puerto Rican population, and they might have different messaging and communication needs than, let's say, a Mexican migrant community somewhere else in the States. And like I said, public health interventions are meaningless without the community relationship. So it's a constant process as you are using social media, a constant, did this work? What should I do better? What do you recommend? Something else that's important is to plan. So have content that is relevant, consistent, bold. And what I mean by consistent is if you say post one day and then don't post for 2 months, it's very likely that you're not going to have a lot of engagement or that you're going to be a voice people go to just because there's always going to be social pages who are consistent in their posting. And you want to be bold. There's a lot of information out there. And so you want to have things that will grab someone's attention. For example, I'm Colombian, so if I saw something with a Colombian flag and maybe a Carlos Vives song, I'd be way more likely to pay attention to that because it's relevant to me and bold in that way than to pay attention to just something that's written out like anything else that's on the media. As you know, there's a lot of information out there, so we want to have things that'll grab people's attention. And then we want to be flexible. We want to continue to mold our plans, like I said earlier, to the needs and responses of the community. So constantly going back for feedback, constantly be teachable, because at the end of the day, it's not about us as public health practitioners. It's always about power shifting from us to the community and serving them well. And then some last things I want to give time for questions is, like, final suggestions, I guess I would say, is let community guide the conversation. That's always the most important thing. The solutions are always in the community. We're always for the community, with the community. Like I said earlier, being teachable. So being humble enough to say, I was wrong. Maybe I should do this next time. And like I said a little earlier, recognizing the different voices in these spaces and not recreating the wheel. Something that I noticed a lot during the pandemic is a lot of people were rushing to be the best or to be the solution. But that's when it becomes about us and not those we're trying to serve. So collaborating with others in order to uplift the voice of the community and the needs of the community. And in that, also not rushing to fill needs. So we want to be intentional in applying evidence-based strategies for bringing change. I think it's really easy to be like, oh, we need to do this, so let's just do it. But then it wasn't intentional, it wasn't evidence-based. There's no evaluation plan, no monitoring plan. So always be intentional. And then finally, lead with empathy, never entitlement, putting ourselves in the shoes of those, remembering if someone isn't vaccinated, instead of shaming them, saying, hey, I know there's concerns. Or for example, I've seen a lot of videos making fun of those who don't want to get vaccinated, never doing that, but leading with empathy and with love, understanding the fears of those around us. So that's it I have for today. Thank you so much for joining. I know we only have 3 minutes left, but I'd be more than happy to answer any questions. And my email's also here if anyone comes up with any later. Thank you so much. Thank you, everyone, for your kind words. And Daniel, to answer your question, the best way to combat vaccine hesitancy, kind of with what I was saying with empathy, leading with empathy. So, for example, back to my grandma. She shared faith-based reasons for why she didn't want to get vaccinated. And one of the conversations we had is she said, well, I have faith that I'm not going to get the vaccine. And she had recently had heart surgery. And so I said, well, abuelita, like, you had faith God would use the surgeon to help you with your heart surgery, and you still got heart surgery. You still use this medical idea that God gave you. So why can't we view the vaccines in the same way? And so I didn't get mad at her. I didn't say, why would you say that? You know, like, I met her question with empathy, but I also responded it in a way that tried to meet her where she was in that question, but also sharing the truth to it and sharing the truth of the vaccine, obviously kindly and in a way that she might listen to. And And one challenge is that there is a lot of criteria for approving ads. I think that that can be overcome through that relationship. We've actually found that we gain more attention by those in our community sharing things than the ads themselves. So eventually getting to the point where the community sustains that rather than having to put money into ads. But that definitely is a challenge. And one way to overcome it is by doing those creative messaging things, such as crowdsourcing, or creating videos where COVID is slipped in there, but to where it kind of misses that with the creative aspect. Of course, and I do think we are sadly at the end of our time for today, but as I said, my email is on the website and was at the end of these slides, so if anyone has any questions, I'd be more than happy to reach out and connect with you. Thank you all.